Autism is always on the minds of families when it comes to behavioral disorders or the way the child approaches. Language delay is very common. So when any of these are there, the child or the parents start worrying about not the child really, but the parents start worrying about autism. So do you want to summarize autism and when the parent should suspect and what they should do if there is a concern?
Yes. Firstly, what I would like to definitely bring to notice is the epidemic autism is becoming or turning into. The numbers have gone up very, very significantly. About 2 decades ago, it was about 1 in 200, but we are seeing almost 1 in 36, which means in a regular size classroom between 35 to 40, we're expecting one child to be on the autism spectrum. So that's how common it is in today's day-to-day practice we are seeing. To understand what it is, it's a neurodiverse condition where there are social deficits predominantly. It could be interacting, communicating, reciprocating. And one of the signs which parents often identify is the delay in their language, which starts off, I would say, as early. Parents recognize this by about 1.5 years. And we do see average age at which they present to a clinician is about 2.5 to 3 years, because they give them that time to catch up on their language or speech. What is very important in identifying are some of the early signs. Reinforcing early intervention is very, very important. So what a parent should look out for is any regression, because this is one of the common presentations where the child used to respond, give an eye contact, interact, laugh back, but after about 1.5, between 1 to 2 years, at any point of time, they see that these have started reducing. The response has become lesser, the babbling and communicating has become lesser, they're not socially engaging and interacting, and the speech has not developed. These are some of the important early signs that the parent has to understand and pick up, and definitely raise this to the pediatrician to understand what is happening with the child in terms of their development. And for older children who have speech, so let's say their language is developed, most often they come across as language which is not very functional, which means they're saying a lot of rhymes, they know all the alphabets, numbers, colors, they're able to sing, they're able to fill in the blanks, or they're able to even read sometimes, but they're not able to communicate. Simple following, back and forth, playing with other children, engaging, socially adapting. So for a child who's a little older in terms of about 3 to 4, where a lot of language cognitive development is showing a difference, that is again a sign of social deficit. So both these could be the common presentations of what parents should be aware of. And what is very important is to have the pediatrician look into the development of a child in a little more detail, trying to understand, because we want to try and guide them into optimizing these deficits as early as possible. And early intervention is the key. And autism is a spectrum, so every child is very different, so they will not be able to compare that what one child is doing is not with the other, but working around the potential of a child becomes very, very important.
That's where, the busy pediatrician in his clinic may not have the time, or so a referral to a developmental pediatrician like yourself or Dr. Arif would be quite helpful in these situations. So, do you get enough referrals from the pediatricians or do they leave it till late?
We do get referrals. I would say it's a widespread presentation. Most often we do get referrals. We also have a lot of them who do the checklists at when they come for
The
vaccination.
chat.
Yes, yes, the MChat, which shows any risk when the concern is raised, they immediately get referred. While sometimes the children, especially when the deficits are not very obvious or they're a little on the milder side, they tend to present a little more later, about 3 to 4 years, where they've entered into school. There's a lot more social situations requiring their participation, is when we notice that these challenges are becoming more and more difficult for the child.
One question many parents have is whether there is any treatment. So obviously, it's more supportive, isn't it? It's related to the way the brain is structured or the functioning is happening. So it's not going to cure, but you work around it, right?
Yes, definitely. It's not curable, but we wouldn't say treatable as well, because in today's neurodivergence or neuroaffirming practices, we don't say it's a disorder anymore. We say it's a difference. So your brain is wired differently, functioning differently. You try to understand how to function, make best use of that. So how they would learn better, or how they would engage better, how their cognitive development can be better in their own ways. And what becomes important is to support. So it's again a very collaborative approach with occupational therapists, the speech therapist, the behavior therapist, clinical psychologist, developmental pediatrician. So it's again a multidisciplinary role, along with the school and parents who will try to work with the child to minimize those gaps and help them be as functional as possible.
Yes, and this is a field where, many parents are worried about vaccination, and we would like to reassure that there is no real link between MMR or any vaccines with the autism spectrum, even though there were some rumors about it and it has been disproved. The other point is this is an area where lots of quacks develop, and they bring in different things, allergy treatment, elimination diets, and there may be occasional children because it's linked to neurotransmitter and things. So there may be the occasional child who benefits, but it's not evidence-based, and you should be careful that you go to a team who manages with a team approach and evaluate what works for a child. So behavioral therapy and parental support is likely to work more than these elimination diets, which are going to be taxing and which is like a hit or miss and probably not evidence-based. Do you agree with that?
Yes, sir, absolutely. We are seeing a lot of stem cell therapy, hyperbaric oxygen, heavy metal detox, or allergies, diet modifications, which are increasing in number. And we do tell the parents that make sure these are standardized, if at all. Like, say they want to go in for a stem cell therapy, there were very few centers across the globe which run these with a standardized set protocol. And these are again a part of the trial. They're not evidence-based treatment options that come in. So we tell them, do your research, go get a complete information of what the authorized body is telling you all, and only then you can choose a particular treatment. But it should not be a resort which we go on to because one thing is not working and moving on to the other.
I know there is a lot of information on genetic approaches and advances, and in terms of how, even though it doesn't change your diagnosis, it changes the approach to treatments. Certain genetic types may have response to certain treatments. Is there anything developing in that field?
There is a lot of research, like you mentioned, in terms of identifying the genes which have this predisposition. But at this point, we are yet to reach to an entity where how this is going to change the management of the child, especially towards US, where we have a larger gene population. Trying to understand it becomes easier. But at this point, with the limited resources that we have, especially with insurances not being able to cover a large amount of these, becomes a financial burden on the family. So unless we are seeing a very obvious syndrome with a neurological condition, and something needs to be treated, like say they have epilepsy or seizures and an ongoing neuroregression with autism, then it becomes important because it will change your line of management. But
Because it's
otherwise,
not covered in the insurance, you would have to discuss this with the family. Cost
the
benefit
family,
comes in as well.
and
So they would
also
rather
we
spend it
may
on
or may not.
therapy.
Yes, because we may or may not get an answer at the end of the genetic panel as well. So if the parents are keen, then possibly they can go into it. But if not, then
Unfortunately, in UAE, everything is expensive in terms of regular treatment, and there's no way around it. But that's a challenge most parents face. The locals get insurance support, but the non-locals may not get coverage for most of these behavioral therapy and support, which is the key to the management. So hopefully,
so financial relocation, allocation becomes very, very important to discuss with the family as well as to
even
what
the
is their.
schools start charging more for support, isn't it? So
Yes,
financially,
yes.
it's challenging, and for families, they have to support each other, and because it becomes stressful for, you should allocate enough time for the other children as well, and looking after affected children with any neurodevelopmental problem is very stressful. So respite is important. We should focus on parents' health, parents' emotional well-being, siblings' health as well, and discuss these things when you go to the developmental pediatrician as well. So, Dr. It has been great.